Hi, I'm Coco Areswald again from the Community Action Team, or CAT, from the School of Public Health at Berkeley and from I4Y, or Innovations for Youth. I am here to share with you our third video for providers for youth experiencing homelessness to help you know what you need to know about COVID-19. So this video is on personal protective equipment. Want you to understand the different types of personal protective equipment, and importantly, understand what their limitations are. They aren't perfect, and how to dispose of them, and some guidance about when to use them in different situations in drop-in and in shelter settings. So what do I mean by personal protective equipment? Personal protective equipment. You might have heard this term PPE, and that's what we're talking about. PPE include gloves, they include masks, so both surgical masks and what you've heard of N95 masks. We'll talk a little bit about those. Gowns, as well as eye protection. And eye protection can be a plastic shield that extends from a mask. Those you usually see more in hospital settings, or some kind of plastic glasses that you might wear, some kind of goggles like that. They don't have to be tight fitting. You might see something like that, like in construction goggles as well. So anything that can protect the eyes. Your own glasses can act as eye protection. You just want to be sure that you're cleaning them frequently and washing your hands after you do. Let's talk about gloves first. So it's important that you know that gloves don't make your hands superhuman. The gloves are going to cover your hands, but then they're going to become dirty. So they're not enough. And it's important to know that your hands can get contaminated while you're wearing the gloves or while you're removing the gloves in particular. It's also important to be sure that when you're wearing gloves that you not touch your face, your mouth, your nose, or your eyes with those gloves. You have to consider those gloves to be super duper nasty. And so you don't want to be touching yourself with those gloves. And you want to be sure that you're changing gloves regularly. So you don't want to just put on a pair of gloves at the beginning of a shift and keep them on that whole shift. That's going to keep you from washing your hands. That's a really bad idea. And those gloves are going to just get increasingly dirty. So terrible idea. So if you are working closely with youth, you want to change gloves between clients. So for instance, if you're doing screening or taking people's temperature, and then otherwise, if you're doing social distancing in your setting and you're wearing gloves because you need to in the setting you're working in, you want to just be sure you're changing them regularly. So in this picture, you can see that this person has taken off their left glove already with their right gloved hands, but now they're holding that left glove with their hand. So now they've made this hand contaminated and dirty. And now they're going to take this right hand glove off, and now both those hands are going to get dirty with those dirty gloves. So that's a big no-no. You want to be sure you throw gloves away right away in the garbage can, and you absolutely wash your hands afterwards. Let's talk about masks now. Masks are a really important form of protection, just like gloves are, but just like gloves, they also aren't perfect. So they're good for wearing around clients who might be coughing or sneezing so that it can protect you, protect your mouth and your nose from those folks, but they don't provide a tight seal around your face. And so that means that it's possible that contaminated air can get into a mask and also on the outside of the mask. And what happens is that as you breathe, there's going to be moisture inside the mask and moisture outside the mask. And the particles that enter the mask will then get into the mask and contaminate the surface of the mask. So that means that the inside of the mask and the outside of the mask over time are going to get dirty. That doesn't mean you shouldn't wear them, but it means that you want to be careful with them because they are going to get dirty. So masks are really great to put on folks who are sick. So not just to protect us, but even more importantly, to put on people who are sick. Because if someone is sick and they cough or sneeze while they wear a mask, the mask is going to protect the people around them from what they are coughing out or sneezing out. So that's the a very important and very key use of masks for you in your settings. So you want to be sure that after you've used a mask that you throw it away. And just like with the glove, you want to treat it like it's something dirty or contaminated. So you want to put it in a garbage can right away. You don't want to put it down on a counter or a surface. You want to throw it away in the garbage right away. And then you want to wash your hands afterwards. So what about N95 masks? We keep hearing about N95 masks. N95 masks provide a very tight seal, and people are breathing through filtered air. And so that has the advantage if it's put on properly, which most of the time, those of us who don't wear them all the time don't tend to put them on properly. So if it's put on properly, you don't have that leakage of air, and the air is only going through the seal. However, these are indicated for one particular situation, or mainly for a particular situation, and that is when germs or viruses become aerosolized. So that means they've turned into this fine mist in the air, and that's not going to be something that you're going to encounter generally in the drop-in setting and in the shelter setting. The coronavirus doesn't tend to stay aerosolized, and it has weight and it just falls within 6 feet. That's why we want to stay 6 feet apart. And that N95 masks are needed when certain medical procedures, like if you're putting tubes down someone's throat, something like that might cause the virus to become aerosolized. And so that's why we're trying to preserve these masks for healthcare providers who are conducting those kinds of procedures. So what does that mean for PPE for staff, for people who are working with youth experiencing homelessness? So I've tried to divide here the kind of protection you need depending on how you're interacting with young people. So if you're in a reception area, so you're the first person that a young person is encountering when they're getting to a drop-in center or they're getting to a shelter, then you would want to have some kind of sneeze guard potentially, so some kind of plastic shield that they're standing behind. And that's because the folks who are coming in and meeting that receptionist or frontline person those folks haven't been triaged yet. The clients who are showing up haven't been triaged yet. So you don't know if they're sick, you don't know if they have a fever, you don't know if they feel just fine. And so you need to be sure that those frontline folks are protected. So they should either be behind a sneeze guard or they should be at a 6-foot distance from folks. So someone could potentially come up to a line and then staff could be 6 feet away and at least ask those initial questions that might tell you whether they need to wear a mask or not. Or they should wear a mask, some kind of eye protection, gloves, and gown. Most places don't have all of those. I would say the most important would be that people wear a mask and gloves in that situation. And similarly for the folks who are doing the screening. So for the folks who are checking young people's temperature in particular, they should wear a mask, eye guard, gloves, and gown ideally. And again, preferably at least the mask and the gloves. And remember to change those between clients and wash your hands between clients. For staff who are working with youth who have no symptoms, so the youth who are well, they're totally fine, they have no symptoms, then they don't need to wear any PPE and they should just maximize social distancing. So these staff are in the same position that we all are in when we go to the grocery store or the drugstore. We're not being told to wear PPE in those settings. There's no reason to right now. And we just want to be sure we're maximizing social distancing. And so I know it's hard to do that in shelters and in drop-in centers, but If you can't maintain 6 feet distance, at least maintain as much as you can. It's kind of a harm reduction approach, and certainly encourage people not to touch each other. Sorry, I keep going forward on the slides there. And then folks who are working with the sick clients. So remember we said there are folks who are sick but not so sick, who might be able to stay in their own room or in a large, well-ventilated room. And those folks should also wear a mask, eye guard, gloves, and gown, preferably. Again, if you don't have all that, prioritize the mask and the gloves. And those folks should be changing that mask and those gloves carefully on a frequent basis, throwing them away in a garbage can, and washing their hands. And finally, folks who are cleaning spaces where people are sick, or where spaces where someone who is known to have had COVID-19 has been, they should also wear a mask, eye guard, gloves, and gown. And if you have N95 masks, you would want to prioritize them for these folks. So I can't emphasize it enough. Everyone needs to wash their hands frequently with soap and water for at least 20 seconds. That is absolutely critical. So whether you are in a low risk setting or higher risk role, you want to be sure that you're doing this, or you're using hand sanitizer. Again, you don't need to do both. It's a waste of resources, but you want to be sure that you're washing your hands properly, or using hand sanitizer on a regular basis. So for that reason, our next video is going to be about washing hands and about safely removing gloves. We hope you're finding these videos from the CAT team useful. Please respond to our survey with your questions or feedback. Thank you so much for all you do for young people, and be safe and be well. Thank you.